Hi everyone, Sandy. Today I'm gonna be talking about nicotine addiction. So what is nicotine addiction? Nicotine addiction is a pervasive and complex health issue that profoundly affects individuals across the globe. Nicotine, the addictive substance found in tobacco, has a far-reaching impact on various organ systems within the human body. Beyond its association with respiratory concerns, the consequences of nicotine addiction extend to the cardiovascular, nervous, reproductive, and oral system. And let's talk about anatomy. The first one is the respiratory system. When inhaled, directly affects the lung and constricts the bronchioles, causing reduced airflow and increased mucus production. In addition, smoking reduces the number of cilia in our lungs, leaving fewer to properly clean them. Chronic exposure leads to inflammation, contributing to conditions like chronic bronchitis, emphysema, and pneumonia. Lung tissue undergo damage, reducing their elasticity and compromising respiratory function. And here I got the picture for the smoking alveoli. So it's the patient who has a pneumonia, smoking damages the cilia and mucus production increased and fluid buildup here. And with the material pools inside of the lung, this can cause an infection that leads to pneumonia. And nicotine significantly impacted the cardiovascular system by elevating heart rate and blood pressure. This chronic stimulation contributed to development of the atherosclerosis here and also called the plaque buildup in the arterioles, increasing the risk of heart attacks and strokes. The arterioles become narrower, and we can see picture shows here, affecting blood flow and overall heart health. And now let's move to the nervous system. So nicotine stimulates the release of dopamine in the brain reward system, leading to addiction. Over time, neural pathway become altered, affecting cognition, mood, and reinforcing the addictive cycle. I'm going to talk about more about this the next slide. And the reproductive system, nicotine negatively impacts fertility and pregnancy outcomes. In female, it can disrupt the menstrual cycles and reduce fertility. In males, it may contribute to erectile dysfunction and spur abnormality. And the smoking, is known to increase the harmful substances called reactive species um, ROS, which has the picture here shows, and leading to oxidative stress, OS. This stress has severe effects on the health, shape, and function of spur. And last one, the digestive system. Nicotine affects oral health by increasing the risk of gum health, tooth decay, and tooth loss. And it compromises blood flow to the gums and diminishes the body's ability to fight infection. And okay, now let's talk about the physiology. The first part, the neurotransmitter communication, which I mentioned a little bit. The next slide, dopamine release. Nicotine stimulates the release of dopamine in the brain reward system, creating pleasurable sensations. And here, and we talk about the reward pathway activation, the mesolimbic pathway, and the picture shows here, and involving dopamine release reinforce the rewarding effects of nicotine. The mesolimbic pathway, sometimes refers to as a reward pathway is dopaminergic pathway in the brain. The pathway connect the ventral tegmental area in the middle brain to the ventral stratum of the basal ganglia in the forebrain. And now let's talk about the hormonal feedback loop. The stress hormone nicotine activates the release of the stress hormones like cortisol, influencing the body's stress response. The reproductive hormone in the reproductive system, nicotine may interfere with the hormonal signals impacting fertility, and the genetic factors, receptor variability, genetic factors influence the number and the sensitivity of the nicotine receptors, affecting an individual's susceptibility to addiction. And the nicotine is metabolized mainly in the liver by enzyme cytochrome P450 and CYP2A6. And the pathophysiology, the first one, the neurotransmitter imbalance. Nicotine stimulates dopamine release for pleasure. However, chronic nicotine exposure desensitizes dopamine receptors, disrupting normal reward signaling. The brain adjusts by reducing neural dopamine production, leading to dependence, and the end for increased nicotine intake to feel pressure and pleasure. This disrupts the homeostasis of neurotransmitter balance, contributing to addiction. And the prolonged nicotine use causes hormonal imbalance, impacting the stress and response and fertility, disrupting in cortisol levels and the reproductive hormones contribute to addiction related stress and fertility issues. And so the genetic factors, variations in receptors disrupt the normal homeostasis of neurotransmitter signaling, making some individuals more prone to addiction. The cardiovascular disturbances, chronic nicotine exposure leads to cardiovascular issues, including increased blood sugar and heart rate. This disruption to regular homeostasis can result in like a hypertension and cardiovascular disease and the respiratory complications. Long-term nicotine exposure damage lung tissue, compromising respiratory function. This disruption to homeostasis contributes to conditions like chronic obstructive pulmonary disease, COPD. And let's move to the diagnosis. So nicotine is not typically classified as a disease, rather it's a substance use disorder. The diagnosis, clinical assessment, health care professionals evaluate a person's smoking history, dependence level, and withdrawal symptoms. Questionnaires, various screening tools and questionnaires help assess the variety of addiction biomarkers. Some tests measure nicotine or its metabolites in the body, providing additional information. And the medical and treatment, the first one, the pharmacotherapy, nicotine replacement therapy, like patches, gums, lozenges, and the nasal sprays help manage withdrawal symptoms by providing controlled amount of nicotine without the harmful effects of smoking. I got this picture. I really recommend this one. My dad is a big smoker for decades. Recently, he's been cut down a lot. So he used to smoke like one patch or more. One pack or more in one day, but now it's like just smoke one or two. So yeah. And Prescription medications, drugs like bupropion and varenicline may be prescribed to reduce cravings and withdrawal symptoms. Behavioral modifications, consultations, and therapy address the psychological aspects of addiction. Cognitive behavioral therapy, CBT, helps individual identify and modify patterns of thinking and behavior associated with smoking. Supportive therapy, motivational enhancement therapy, MAT, enhances motivation to quit and builds up a plan for change. Contingency management provides intensives for abstinence. And the cure and the recurrence, ongoing support, counseling, and coping strategies. And the physiological changes, nicotine acts as agonist to nicotine acetylcholine receptors in the brain, leading to the release of neurotransmitters such as dopamine. Over time, the brain adapts to the presence of nicotine, and withdrawal symptoms occur when nicotine levels drop. Side effects, NRT side effects like irritation, nausea, insomnia. Prescription medications, potential side effects include headaches, mood changes. AI models can assist in diagnosis and treatment plans. Predict models and treatment support and behavioral interventions. And now let's talk about the demographics. So genetics, heredity may determine how receptors in the brain responded to high doses of nicotine delivered by tobacco products. Family and friends, children with parents who smoke are more likely to eventually take up smoking themselves. Children with friends who smoke are also more likely to try cigarettes. Age, the younger the person is when they start using tobacco, the greater the chance they will continue to smoke and develop nicotine dependence as adults. And coexisting mental health problem. So people with mental health problems such as depression, anxiety, and schizophrenia have much higher rates of tobacco use. The other substance use, people who use alcohol, cannabis, and illegal drugs have much higher rates of tobacco use. The social factors, environmental influences, peer pressure, and socio-economic status contribute. And according to WHO, 80% of 1.3 billion users in low to middle income countries. In 2020, 22.3% of the world population used tobacco. 36.7% of men and 7.8% of women. Around 14% of the adults in the United States smoke cigarettes. Smoking is generally more common among men than women. There are more than 300 million smokers in China, nearly 1/3 of the world's total. Tobacco kills more than 8 million people each year, including an estimated 1.3 million non-smokers who are exposed to secondhand smoke. Cigarette smoking remains the leading cause of preventable disease and premature death in the United States and other countries. On average, 435,000 people in the United States die prematurely from smoking-related diseases each year. Overall, smoking causes 1 in 5 deaths. The chance that a lifelong smoker will die prematurely from a complication of smoking is approximately 15%. Very horrible numbers. So that's it. Thank you so much. And I got the references here. You guys can take a look at them. Thank you so much.